Hi, my name is Peyton Awaya, and this is my Scenario 2, Patient in Labor with No Prenatal Care. My stomach hurts so bad. I think I'm having the baby. Hi, my name is Peyton, and I'm going to be your nurse today. I know that you're hurting, and I can see by the way that you're breathing, it's feeling pretty intense. You're in the right place. I'm going to help you. Let's start by getting you into the bed so that you can rest. First, I want to explain what's happening to your body so that it's not so scary. What you're feeling is a contraction. Your uterus is a big and strong muscle, and when you get a pain, it's squeezing tight at the top. It's trying to push the baby down while simultaneously pulling the cervix open. That's the bottom. It's kind of like pulling a sweater over your head. The pain comes in waves. It'll start like building up to a hill, to a peak, and then it'll fade away. When the peak hits, that's when I'm going to need you to focus on me because that's when it's going to be the most intense pain. You're going to want to breathe in through your nose, count 1, 2, 3, and then blow it out through your mouth like you're blowing on soup. Good. Keep doing that. Now, we're going to listen to this for a full minute. I'm going to listen to the heart sounds. The heart rate is strong, about 140 beats per minute, which is perfect for your baby. Since you haven't had an ultrasound recently, I'm going to feel your belly with my hands, if that's okay with you, so that I can figure out which way the baby is facing. Okay, thank you. I'm going to feel your stomach. Okay, feeling up here, this feels like the bottom, and down here feels hard and round, which is the head, which is good news. It means that the baby's head is downward and it's ready for birth. Have you seen a doctor? No, I haven't seen a doctor. This is my first time here. Okay, that's perfectly okay. Please just take a deep breath and let go of any guilt that you're holding on to. You're here now, and that's what matters. We see this often, and we know exactly how to keep you safe. Since we don't have your records, I'm going to have to do a full safety check on you, but I'm going to do a quick head-to-toe assessment right now. First, I'm going to listen to your heart and lung sounds with my stethoscope. Okay, sounds clear. That's good. Now I'm going to check your ankles for swelling. A little swelling is normal, but since you haven't had any checkups, I need to make sure that you don't have any high blood pressure or preeclampsia. Do you have a headache right now? No? Okay, that's good. How about any blurry vision, or are you seeing any spots? No? That's great. Now for the labs. I'm going to start an IV in your arm. We do these labs just as procedure to make sure that everything's going okay. First lab that we're going to do is a type and screen, and this is going to tell us your blood type and whether or not you're negative or positive. We're also going to check a CBC lab to check iron and platelets. We're going to next do an infection screen. An infection screen will help us check for HIV, hepatitis, and syphilis. We do this for every mom with no records, just to protect the baby. We're also going to do a Group B strep test. Since we haven't tested you for a common bacteria such as this, the pediatrician will likely want to give us your IV antibiotics during labor. This isn't because you're sick, it's just to help shield the baby's lungs during delivery so that we can prevent infection. Does that sound okay? Is my baby going to be okay? It's completely normal to be scared. The fact that you're asking shows that you care deeply. Since I can't speak about the last 9 months, let's look at the evidence that we have right now. As you can see on the monitor, this is the baby's heartbeat, and the little jumps that we see are called accelerations, which means that the baby is moving and that the heart is responding normally. It tells me the baby is getting enough oxygen. You're 37 weeks, and the risk with no prenatal care is that sometimes the baby is smaller than expected, and this can be an intrauterine growth restriction issue. But feeling your belly, the size seems right on track for 37 weeks, which is great news. Once the baby is born, since we don't have any history, the baby might have to stay in the nursery for a few extra hours for observation, just to check blood sugars and watch for infection and routine things like that. But as of this moment, your baby seems happy, healthy, and stable, which is great. I'm really nervous because I don't know what to expect, and I don't have anyone here with me. Thank you for sharing this with me. You're not alone. I'll be your partner in this until your support person arrives, or even for the whole time if you need me to be. But let's map out the next few hours so that you know what to expect. First, we're going to do a cervical check. This is where the doctor is going to check to see how dilated you are, typically 0 to 10 centimeters. Next, we're going to do pain management. We don't want you to suffer and we don't want to be in pain, so we can help you do this in a few different ways. For starters, we can help distract you, we can do some meditation techniques, breathing techniques. That's if you don't want any pain management or non-pharmacological pain management. If you do want pharmacological pain management, we can offer you a few different options. First, we have IV meds that we can give you. We can give you medicine through the IV in your arm. It'll help you feel a little sleepy, but take the edge off. We can also give you an epidural. This is where an anesthesia doctor puts a tiny catheter tube in your back to numb your belly. You'll feel the pressure of the contractions, but you won't feel the pain anymore. Next is pushing. Once you get to 10 centimeters, we're going to teach you how to push. You don't need to know how to yet, but we will coach you through every single one because we're going to be here for you every step of the way. Also, since you haven't had any classes, I want to tell you some things that we do for the baby typically immediately after birth so that you can tell us if that's something you're interested in. First, we give a vitamin K shot in the baby's thigh to help with blood clots. We also do eye ointment to prevent for eye infections. These are standard safety measures that we do for all babies and that we really, really recommend. I want you to know that this is an option for you as well if you choose. If I call the baby's dad to come, will he get in trouble since he's 35 years old? Thank you for sharing this with me. I'm glad that you trusted me enough to ask this. My priority as your nurse is to help you and your baby and to keep you guys safe. As a nurse, I am a mandatory reporter. This means that if I suspect abuse, coercion, or if you are under the legal age of consent when the conception occurred, I have to report it. But if that's not the case, and he's your support person, and he makes you feel calm, he's more than welcome here. But I do need to ask you the hard questions first. For starters, does he make you feel afraid at all? No? Okay, that's good. Does he control money or your phone? No? Well, has he ever hit you or forced you to do things or been abusive to you? If the answer is no to all of these and you want him here, call him. If the answer is yes, then you need to tell me now so that I can help keep him out of the hospital. We will have security stop him at the door if that's what you need us to do. Do you have to tell my parents? They won't be happy with me. This is a very common fear. Thank you for sharing that with me. Regarding your medical privacy, we respect your confidentiality. However, because you're a minor and under the age of 18, I want to be honest about the fact that we are legally obligated to tell them. Regarding visitors, though, you are the boss. If you tell us that you don't want your parents in your room, we enforce that. We can make you a confidential patient in our system as well, which means that if your parents call the front desk asking for you, the hospital won't have to give them any information about that. We can give you that bubble of peace for now so that you can just focus on you and the labor and the baby. What if I want an adoption? What are my options here in Nevada? I just want to say that I'm so glad that you're being so brave and open with me. Considering adoption is a very, very mature and loving decision, and I want you to know that there's absolutely no judgment here. You have a few main paths in Nevada. We can help you with both. For starters, option 1 is an adoption agency. We have a social worker that I can call to our hospital whenever you want, even right now if you want, and she's wonderful. She can come to talk to you about open adoption. This is where you pick the family and you can get updates, photos, etc. Or a closed adoption. This is where she can contact the agency immediately to start this, and it essentially ensures that you're signing off the ability to keep in contact with the baby. It's totally up to you though. The next option is that Nevada has a safe haven law. This allows a parent to surrender a baby up to 30 days old to a medical provider, like here at the hospital, without any questions asked, without any police involvement, as long as the baby is healthy and unharmed. You would just hand the baby to us and tell us that you're using the safe haven law. You don't have to decide this second. You can deliver the baby and see how you feel then. You can talk to the social worker then. It's totally up to you. We are here for you. Would you like me to page the social worker to come sit with you? She can answer the legal questions much better than I can. Thank you so much for letting me be your nurse today and for letting me take care of you. I really appreciate you sharing all this information with me, and I can assure you that you are in great hands.